Hello everyone and welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and obesity medicine doctor. I'm recording this video on Sunday after Halloween and Diwali, so I hope you had a great time. Today we are talking about the relationship between obesity and obstructive sleep apnea, also called OSA. If you ever wondered how weight impacts sleep apnea and why it is so common in those with obesity, stay tuned and let's dive right in. First, let's talk about what is obstructive sleep apnea. It is a sleep disorder where breathing repeatedly stops and starts during sleep due to blockage of the upper airway. This can cause poor quality of sleep, daytime fatigue, and even lead to long-term health complications. But one of the most significant risk factors for obstructive sleep apnea is obesity or excess body weight. Why is this? It comes down to way excess body fat affects our anatomy and physiology. So let's talk about the airway compression. For one, extra fat around the neck and the throat area actually compresses the airway. This makes it more likely to collapse while we are sleeping. The narrower the airway, the greater the resistance, and this resistance can make it breathing difficult while we are asleep. In fact, a neck circumference greater than 17 for men and 16 inches for women is often associated with higher risk of obstructive sleep apnea. So is there a relationship between abdominal fat, lung volume, and obstructive sleep apnea? Yes, you guessed it right. It is. Now, it is just not the neck fat. Abdominal fat or visceral fat or abdominal or fat around the waist can also play a big role here. Increased fat around the abdomen reduces the ability of the lungs to expand fully while and this decreases the lung volume and oxygen levels. This puts a strain on our breathing while we are lying down at night, leading to more frequent apneic episodes, meaning we are not breathing during those periods. Number three is the inflammation and hormonal changes. So there is a huge impact of inflammation and hormonal changes. And as a rheumatologist, inflammation is very near and dear to my heart, and obesity is no exception. Obesity leads to higher levels of inflammation throughout the body, which affects respiratory health. Additionally, certain hormones like leptin, which when become dysregulated, can cause weight gain. Leptin is involved in breathing control, but with obesity, its effectiveness can reduce, which can make it breathing even harder while asleep. Leptin is also the hormone that helps us lose weight. So there's a vicious cycle where it gets trickier as we go deeper into increased obesity and obstructive sleep apnea. The vicious cycle is at play here. OSA itself can lead to weight gain. It disrupts the sleep quality, leaving people tired and have low energy during the day. This often leads to less physical activity and poor dietary choices. Additionally, if sleep apnea affects the balance of hunger hormones like ghrelin and leptin, it makes us more hungrier. We have more appetite, it leads to more weight gain. And more weight gain in turn worsens sleep apnea. So now you can see the cycle continues. So obstructive sleep apnea and obesity do not just exist independently. They both contribute to higher risk of other health issues like hypertension, cardiovascular disease, type 2 diabetes. So when obstructive sleep apnea and obesity coexist, these risks compound, making it's become very crucial for us to consider treatment. So what's the takeaway today? Well, managing obesity is one of the most effective way to reduce severity of obstructive sleep apnea. Weight loss can significantly reduce the frequency of these episodes and improve the breathing and sleeping quality. So if you or someone you know struggles with weight gain and sleep apnea, lifestyle changes, weight loss medications, and other interventions can really help them. Thank you for tuning in. If you found this information helpful, please like this video and subscribe to my channel, and feel free to share your experiences with others. At the end, sleep is really important for your good health and management of your weight, and you should seek help of a health professional who can help you on this journey. And I will see you next time on Youthful Medicine, where we explore the keys to a healthier, more vibrant life.